Hey everybody, today we are going to do a reaction video for botched injections. We have Rocky with us. Rocky. We have Rocky with us. On YouTube, I have a pretty good idea that botched injections videos, one, are going to mostly bring up Botched, the show, which is amazing, but we're gonna be reacting to like getting lip filler. We're not gonna be reacting to the cement videos. I'm hoping we'll find some videos where we can talk about what went wrong. But two, I also feel that there's gonna be a lot of YouTubers saying, don't get fillers, I dissolved my fillers. I have a lot of feelings about this, but this is gonna be on a video by video situation. So we'll see what we have going on here. If you don't know me, I'm Jasmine. I'm a registered nurse with 8 years of experience in medical aesthetics. I practice in Southern California and I mostly practice injectables and skincare, laser devices, chemical peels. So let's see what we have going on. Botched. This is a very famous case. All right, let's see.
I probably have a mustache.
So first thing I see, she has lipstick on and makeup. I can already start to see the texture of her skin on her lips. She will be a little bit prone to bumps. You can see the fine lines. She definitely has an interesting shape, the way the muscle pulls up underneath the lip. She'll absolutely need a more conservative approach to keep her lip filler flawless.
Don't judge my mustache, but I'll do like an up close.
Where's your mustache? Coming from a very hairy woman. Alrighty. Okay, I am taking into consideration that this is immediately after. First thing that I see is that her lip shape was significantly widened. You can see her medial tubercles, like the imaginary little pillows of her lips, weren't focused on so much. It looks like just general volume, but it could just be the swelling.
I'm freaking out a little bit because they're swollen right now.
When I see volume underneath the lip, like you can see when she talks, her nips, but I kind of see some weight underneath, and I'm hoping that's not true. When we get filler underneath into the mucosa of the lip, it's just a bad situation.
So it's a lot, but this is
aesthetically
more than I've ever done, because since they had to put it in these lines right here and do my lips, they did 2 entire vials, which is a ton. Okay, like a ton.
I don't know if you saw that, but I rolled my eyes. Nasolabial folds, smile lines. These lines are very commonly demonized. I think it's very youthful to have some kind of dip in this area. If we take this away fully, we look like a monkey. That rounded out upper lip. So it's important that we have an indentation here. It's often the little creases that drive younger patients crazy. I even have this little crease, and we're gonna smile. You know, that's never really gonna go away. You can add support with filler, but often we don't have a deep enough smile line to warrant too much filler in this area. I do think the piriform space or piriform aperture, this is where filler can really help the nasolabial area. So 2 syringes, one in the nasolabial, one in the lips. I'm not the biggest on. I always side for a more conservative approach, but also not too conservative.
And then within a week, they'll look how they're gonna look.
At 2 weeks, your lips are about 95% healed. You still have some swelling even at 2 weeks. At 4 weeks, the filler, I like to say, integrates with your tissue a little bit. At 4 weeks, it's more accurately close to what your lips are gonna look like long term. 1 week, you're absolutely still swollen. And 2 weeks, you even still have some swelling. We don't think so, but we do. Okay, let's go back.
Right now, like,
so one, I see some swelling outside of the lips, but it tells me that there could be some leakage of filler outside of the lips, and that's how we get migration. When she's fully healed, it's possible that that could not be true, but with how soft her vermilion border is. See, when she opened her mouth and you saw the weight underneath, I would dissolve that. It looks just kind of like general volume with not so much strategy behind that. So I'd love to know what her lips looked like before, because you can see with the lipstick, her lips look more crisp. She could have had some migration, some filler in the mucosa or in the wet dry border, and more elongated lips prior to this appointment, but we couldn't really see it because she had lipstick on before. So you can see with filler in the nasolabial fold and filler in the lips, her lips look a little bit more weighed down. A drop of filler into the piriform space would help support the upper lip, make it look more lifted and not as weighted down. And she did have a Juvederm. Most people do well with most types of fillers. It's definitely up to the injector to place the type of filler in a strategic way. Oh, Migration all the way around. You can see that her vermilion border is significantly softened.
Very comfortable with it.
She's a gorgeous girl. So the thing with lip filler is that when we're youthful and we have some beauty already, we can place filler in pretty much any way and just love how it comes out because we don't know what it could look like if it was better. Yeah, so you can see with the texture of her lips, there are some superficial little bumps. You see all this weight on the side. It's just, this drives me crazy. And so this caption, OMG, I thought it was botched. Botched is a very fiery, fueled word. And when we think of like a botched surgery, there is some kind of risk to a patient's life. So a lot of lip filler isn't necessarily botched. I think it's just poorly performed. This quality is rough. Ah! I don't see anything wrong with this. I think that's completely, it's gorgeous. I can't believe these are her lips. Wait, what? Are these her lips? I'm confused. Okay, okay.
Hi guys, welcome back to my channel.
Oh. Oh no.
Trying to find someone good, someone that I...
Social media gurus, or not gurus, but social media influencers seek out this look. A very, very full uplifted upper lip. We have the keyhole going on in the lower lip. This is definitely not my favorite approach to lip fillers, but it is highly sought after.
And it's also like with travel and work, it's hard to find.
You can see it's also very, very firm when she moves. But with time, this filler is going to not look as good the more time it's there. So the sooner she dissolves, the better. Okay, so she has a smaller lips, which needs to be approached with, of course, a more conservative approach. With smaller lips, there's less room to add volume most of the time. And so you can't just plump them up to the desired size with 1 or even 2 or even 3 sessions. It takes long term of building these lips up. I'm already ready for her philtral column to be the exact same length. It's gonna be weighted down. It's not gonna be uplifted.
So if you stay...
Yep, so you can see how long her philtral column is, stayed exactly the same. Significant creases. This isn't where her natural nasolabial fold is. When we start getting enough volume in the sides of the lips and it leaks out, we get this little hook crease. So if you do see that, go in and dissolve. Let's go through some other videos. So of course, why I stopped, and you should too. A lot of issues with like when Kylie Jenner reversed her lip filler is that she absolutely still has filler in there. Another thing, if you have lip filler and you are waiting for it to go away, it's never gonna go away. It really isn't. There's a really popular YouTube video about how filler anywhere in the face lasts so much longer than we anticipate it to. It's kind of like if you have a nice crisp sandcastle and then over time the water washes over it, it just kind of softens down, which is why we don't want this in improper areas to soften down. We want it in the body of the lip, we want it in the appropriate areas. So this video is not meant to be botched, but let's critique it anyways. Okay. So quick glance, she has nice petite lips. One thing that I do see is that when she smiles, her teeth pushes on the sides of the lips and can have a little volume, and that's natural. Oh, yeah, super cute. Look at that shape, gorgeous.
And they're so small in that. They look pretty.
You can see there's either a little bruise or a little collection of filler on the lower right lip.
Yeah,
it moves really well. I think it's super cute. A little bit of weight on the right side that might have been no, I don't think that's pre-existing. Look at the left side. You can just see it's a little bit different, which symmetry, we're not always gonna be perfectly symmetrical. Could be swelling. They're cute. I think she did a good job.
So this is me, just a regular girl, and everything seemed to go well. I looked fine.
Significant width to her bottom lip. Her upper lip is okay.
My lips were covered in bruises. They had more lumps and bumps in the cellulite on my left butt cheek, and more swelling than a birthday party balloon. They turned all different colors, red, black, blue. I started to get really worried and nervous because I thought I was gonna lose a lip or something, like lose lip tissue. The bruises were not just all over my lips, but all over my mouth.
Likely the artery was touched or poked with the needle on the lower right side. So when we see black or red or purple outside of the lip, it means some blood leaked out of that area. Her lip tissue itself is pink, but the color outside of the lip is a little bit white. So we'd be concerned about blood flow or filler blocking off a blood vessel, which is why she's talking about a lip possibly falling off, which yes, can happen. But because her lip tissue is pink, she's likely completely fine, but let's take a look.
I wanted you guys to know the risks, and I wanted to be honest, and I also wanted you guys to get a laugh out of me. Let's be honest, I'm just here to make you giggle. So this is my story of my botched lip filler experience. Oh, she's such a bitch, but I am a bitch. Do you just start noticing things that you normally wouldn't notice? And then also with being a YouTuber, you have...
We don't need to explain our choice for any cosmetic treatment to anyone. But I do like it when we're honest about what we have done, because there are a lot of unrealistic beauty standards and it's hard to be able to meet those. And if we do get treatment, we make other people think that it's completely normal and we're completely natural, which natural work is good, but honesty is also good.
I had gotten half a milliliter. I got half a syringe done, like a year
You can see that's Juvederm.
ago, I think, and it literally made no difference in my lips at all. Like,
I always say one syringe, once fully healed, it pretty much is similar to your previous lip size, but it just kind of makes it look a little bit more hydrated. And that's one full syringe. Yes, you're gonna swell and see that crazy volume difference while you're healing, but once fully healed, one syringe is actually pretty subtle.
I don't know what you guys think. I don't think it's that noticeable.
It's very noticeable. You can see migration outside of the lips, mostly on the sides. And I know there's also a little bit of filler in the mucosa or into that wet border underneath the lip, because you can see the volume kind of just does that.
Oh, my whole shit was fucked up. It was not good. But what I will tell you is that I bruise easily and I have a little bit of a vein issue. If you've seen, like, sometimes if I gain a lot of weight, eat too much salt, whatever, like, I have it rough, like, don't exercise enough, something like that, my veins start getting really fucking ugly. So I think I bruise so much because of my veins. Like, they're just, like, not...
No. No, 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 no. So we bruised a lot because in one area, unless she had an anatomical variance where her artery is much more superficial, the needle went a little bit too deep because the artery lies deeper in the lip, typically. She got all that bruising because the injection technique was very rough. Not very rough, I think that's an overstatement. It could be worse, but it wasn't gentle. I really hope the injector didn't tell her that it's your veins. That would, drive me nuts.
If you are having lumps, don't have a meltdown. Maybe in a week or two they'll completely go away.
Sometimes we can get some bumps in the beginning of the healing process. After 2 weeks, you definitely want to make sure they can be perfected out with your provider. Some people will never get any lumps in their lips, and some people will be more prone to it depending on a lot of factors with the tissue.
I know you're not supposed to suck a straw or dick after you get lip filler because that can cause lumps, so...
I don't think using a straw or suction causes lumps. Obviously, we're gonna be moving our mouth, we're gonna be smiling, we're gonna be eating, like these are things we need to do. The lip filler can shift a little bit, but definitely don't go get lip injections and then try to use a straw all the time and like suck a dick, but this isn't what causes bumps. Oh, don't touch it. That looks like an infection. Just that last one, it being more viscous and a little bit more yellow. Okay, first, don't try to do this on your own. Go see a professional. Oh. So for me to say that this is filler, I need to see the consistency of it, which is hard to see. Okay, I hope she's not doing this on her own. Okay, I'm over this. So first of all, it looks like she's doing this on her own. These are the kind of issues that you can run into. We don't know where this filler is from, and even if it says it's hyaluronic acid based filler, it can have so many issues with it. So as she's pushing this filler out, one, she's not wearing gloves. I don't know how clean her hands are. She's using her fingers. She's not even using, the gauze to try to keep the area clean. I want to see multiple alcohol wipes going over this area, and I don't see any of that. And so likely the lip filler was performed the same. I really don't want to give this any more attention. We don't support this. If there are any specific videos that you want me to review and give input as to why the filler doesn't look right or critique any injection techniques, send them to me, let me know.
I'm getting
my lip.
Okay, so obviously she's had lip filler before, and you can see as she's moving her mouth, you see all that filler in the mucosa, ton of migration. Okay, good, we're getting them dissolved. To dissolve filler, we use Hyaluronic, that's the brand, that's hyaluronidase. There's also the brand Vitrace or Vitrace. In the US, we more commonly use Hyaluronic because it has a lower risk of allergy. As she has had multiple syringes in her lip, she's likely going to need multiple series of reversing. That looks like a 0.3 ml cc, and sometimes we can soften down the hyaluronidase with saline or lidocaine. It stings. So some people like to bend the needle just to help the direction. I recently heard of a needle that got stuck in tissue because it was bent, got stuck in the tissue and had to be removed with the help of a specialist. Oh yes. Once again, he's injecting in the body. Hopefully he's making the way down. I would probably start at the mucosa. Okay, there we go. I would have put way more in the mucosa. There's still gonna be a lot of leftover filler underneath the lip. I know it.
And I'm back.
Yeah, okay. So outside looks really good. You can see underneath there's still some weight as I anticipated. So much better.
I like to just bring it down.
Not a fan of the touching. Let's see what he's doing. Dissolving again, good. I'm a big fan of dissolving more on the sides because volume on the sides adds width. Okay, you can still see weight underneath. It's actually really common to bite underneath our lip and create weight underneath that way. She's still, you see this weight right here? Oh yeah, that needs more dissolving. Let's take a look at that picture. This looks like modeling, almost reticulated. When a blood vessel is blocked off, surrounding blood vessels will open up to help try to get blood to that area that's not getting blood.
Of the injections has impeded on a blood vessel, the kind of throbbing and heat. It was really hot, that's enough. It was like really hot to touch. That indicates to me that it probably was a localized infection, probably because she didn't wear gloves and because
How? Okay, if anyone is ever injecting you without gloves, like please say something. I don't care how nice they are.
that I was very lucky that I didn't end up blind with the positioning of where the filler was on.
I like this comment. So this provider doesn't sound like the best provider, but adverse events can happen to anybody and everybody, and the best of injectors as well. But what's important is that they know how to address it if this does happen. I think that's gonna be it for today. I hope you got some insight on why filler can look so not so great. Absolutely do a lot of research on who your injector is. Please let me know if there are any specific videos that you'd like me to review, and I'll see you guys later.